Good morning to Friday Club Online. It's the 16th of December. It's a public holiday and we have a number of people here to join us. So welcome to all of you. Thank you for getting up early to be here. But today I've got a really special guest. I've got Andre Jacob. So Andre has actually written a book called Medical Schemes Explained. And this is a book that I would suggest that every household who has a medical aid takes up, because it actually is your information guide to how to use your medical aid more effectively. But more from Andre, who's the author of this amazing book. And Andre, please take it away and explain to us, tell us about your book, explain to us how to actually use our medical aids more effectively. Over to you, Andre.
Thank you, David, and thank you to everybody here. I really appreciate the kind words, but this presentation is actually dedicated to more than 250,000 people that I've served over my career in a medical scheme environment. I learned from them what their struggles are, what questions they have, and the solutions that we shared with them, and that motivated me to actually author this book. So just a bit of a backstory to this presentation. Let me just in terms of the backstory of the presentation, the Council for Medical Schemes in 2004 held a seminar on the Fair Treatment Project, and they identified 75 different possible areas of unfairness, and part of that unfairness, or a major contributor to that unfairness, was the asymmetry of information that consumers have, where all the power lies with the medical scheme or with the provider or with the intermediary, and that gave me the motivation. The observation that I made at that seminar gave me the motivation to start thinking about drafting this book. However, I needed experience. And during the COVID period, I decided the time is now to do it. But then I needed a bit of motivation. And I found that motivation in my son, that unfortunately passed away recently, but he wanted to become an architect, and he went through a huge amount of training to sketch and so on. And one of the sketches are in the book, and so that gave me that motivation to finish the book. But if you now get into today, well, today is a day of reconciliation, but as you can see, it's a time of huge conflict throughout the world, not only in South Africa, with the Blood River, or the Battle of Blood River, and Mkhonto and Sizwe, that was established on the same day, 16th of December. So, but if we look at reconciliation, the best way to do that is by way of creating relationships, and to learn from each other, and to listen and to grow. And this is exactly what this presentation is about, is to actually assist us to listen and to grow and to create a better relationship with our medical scheme. So in terms of the book, if we look at the content, what can you expect when you look at a book? There's 25 topics. There's 53 tips that I provide to you. There's 70 terminologies that I try to debunk, that asymmetry of information, and various examples. I also have two additional benefits in the book. There's advertisers that provide certain discounts in terms of the book. It's more, the value of that is more than 3,000 rand. So a huge amount of value when one purchases the book. And then also every person that purchased the book is then auto-subscribed to a quarterly newsletter. So it's actually, you have the book, you have the knowledge, but things change in the meantime, and that is updated by way of a quarterly newsletter that I think adds a huge amount of value. So how can you get value out of this book today? So I want to leave with you an acronym ACTION. And the A of action is really to be aware. Aware of your health situation, your type of option that you have joined. Every medical scheme option have different risks, different benefits that they offer, and understanding that and the rules of the medical scheme. If you are aware of your situation environment, that's the first step to using your medical scheme efficiently. The C stands for comply, and obviously we need to comply with the rules of the medical scheme. We need to comply with the requirements in terms of designated service providers where that's applicable, in terms of the chronic medication. We need to understand the rules and comply with those specific rules. When we do that, it is easier and less frustration that we create in terms of our medical scheme. So that's the C. The T really stands for trust. And how do you build trust with your medical scheme? But I would rather speak about the trust that you create with supporting actors in this movie. The one is your broker. And I really think it is important to have an independent broker. And when I talk about the independent broker, I'm not talking about a person that has 5 or 7 or 10 contracts. I'm talking about a broker that has independence of thought, a broker that can stand in between you and the medical scheme and can protect your interests at the medical scheme. But then also your doctor. Your doctor is a very important stakeholder with your medical scheme, understanding what your medical scheme benefits are, and working with your doctor serves a huge amount of value. But then also avoid another doctor, and that is Dr. Google. When we go onto Google, there's a huge amount of information about the same topic. It will say to you, this is factually correct, and on the other side it will say, no, it's factually wrong. So which source do you actually rely on in terms of Google? So your doctor will be able to advise you of the trusted sites that you can actually investigate and understand the diseases that you do suffer from. So with that, it builds trust, and you can then work with your medical scheme more efficiently. The I stands for the inspection. And what I'm meaning by that is your claim statements. Looking at your claim statement, seeing why is it paid from my savings account and not from risk? Is it correct? Is it a PMB? Should it be paid in full? Why is it short paid? Is there a reason why it's short paid? And understanding that. Give you an example, practical example. I'm looking at currently at a specific client, 1,250 claim lines over the last 3 years. 400 of those claim lines were short paid, and of those, about 250 of those claim lines are PMBs that should have been paid, and it's an amount of 16,000 Rand. But that member paid that money to the provider, never claimed it back from the medical scheme, never inquired about that, and now wants to resolve the issue. Now we're going to help the person resolving that issue, but the fact is it was used inefficiently. And so many of our claims or use of our medical scheme are inefficiently. The O stands for own it. And when you purchase a house and you in a body corporate, you attend those meetings. Exactly the same with a medical scheme. A medical scheme belongs to you. We need to attend the medical scheme annual general meeting, hear what I say about the finances of the medical scheme, the benefits, the direction of the medical scheme. It's our medical scheme. We own it. On the other side, we own our body. So being healthy, stay healthy, live healthy, assist us to also use our medical scheme efficiently. It is maintaining the asset that we have. And I think that's immensely important. Then if we go to the numbers, that's the last portion of the acronym, and that's really understanding the reimbursement rates that doctors charge. Also understanding that certain doctors charge between or in excess of 850 rand, and I'm talking about the general consultation, but you can also do virtual consultations at 200 rand or 267 rand, or you can make use of some of the primary care products where you can cut down on the cost of that consultation. In this week, I've used a primary care facility, and the cost is 267 rand, and that included my medication. So I think that's a good way of looking at your medical scheme far more efficiently. So if you take away from today's discussion and you take the word action and you put in action to use your medical scheme efficiently. So my ask for today is, who will benefit from this medical scheme? It's companies that want the employees to understand their product. It's members of medical schemes. It's people who want to join a medical scheme. It's brokers. It's medical scheme administrators. All those people, and if you know those people and can put me in contact with those people, I will really appreciate it. So to assist me, what can you do? So you can buy the book, you can follow me on social media, you can like it, you can share the value of this book on social media, you can introduce me to people or invite me to speaking engagements. And you can also set up a coffee date, and we can discuss over a cup of coffee the value that this book will add to you and to people that you do know. But he must say that he never loses, he either win or learn. So how can you either win or learn? And if you want to know more, you can go to the Facebook page, Medical Schemes Explained. Like the page, get that information, subscribe there. You can also go to the website medicalschemesexplained.co.za that Martin built for me. And then you can also purchase the book. You go to medicalschemesexplained.co.za/book/buy/, and you can click there. It's a couple of clicks, and you can then also purchase the book. You can purchase an e-version of the book, or you can purchase a hard copy of the book. David, I think that's all from my side. Thank you for this opportunity. I'm really honored to speak to your audience about this.
Thank you, Andre. Wow, I must say that was very, very informative. And I must say that's something I need to do, is take action with regard to my medical aid, because I actually sometimes am totally in the dark. I feel like a mushroom. And I think that your book will actually really add value to me understanding and utilizing my medical aid far, far better. So thanks so much, Andre. You've got all the details. Andre's information will be in the chat, and you can also go and have a look at his website. Thanks, Martin, for creating that.